My name is Hania Ward. I'm a consultant anaesthetist. I subspecialise in major trauma, vascular anaesthesia and hand surgery. I came to Southampton for a trial period, initially not knowing whether I will like it or not. But having worked here now 2 years, I know that I'll be staying here for definitely, if not the rest of my career, then a few years. It's a fantastic place to work. It offered me a better balance between interesting work and being one of the leading hospitals in the country, and also with specialising in major trauma, as well as really good life balance and out-of-work activities. It's such a brilliant place for outdoor lifestyle. I sail, cycle and run, for which New Forest is fantastic. I work on 2-week schedule. My duties are divided between clinical and non-clinical job. The clinical side of things is working mainly in theatres, doing major trauma, vascular and hand trauma lists. I look after patients from those specialties. I see them in the morning, and then we start work in theatres where we run through all-day lists. And then at the end of the day, complete my work by seeing the patient after they had operation to make sure they are doing well and possibly ready for home if they are only day patients. My duties as major trauma anaesthetist is also supporting emergency department, where we take part in being major trauma team for patients who have severe injuries and arrive to A&E. The non-clinical duties is a range of office work divided between research, audits and improving the way we work as a whole department. My advice to people who want to work here as anaesthetists or go through anaesthetic training would be to make sure they enjoy what they do. The training requirements often specify the minimum you need to achieve, but my advice would be to aim higher, do the things that interest you and be proactive about achieving your goals. And rather than just going through box ticking, exercising, do the things that bring you joy, because it can be stressful when things don't go to plan, and anaesthetics is a high intensity job. So if you can help that by finding joy in what you do, it makes a massive difference. Good day for me is when we work well as a team. This is very much team activity, and being an anaesthetist, you often end up being the gel that glues the whole team together. I go home thinking I did a good job when we have a patient who's critically unwell, and then because of the good functioning team doing their jobs very well, we manage to get them back to a position when they're stable and can recover from their disease. Is definitely a thing that sends me home with a smile on my face.